Well, there is a test that could predict your risk for certain diseases.
Good information that many of us would like to know, and that's why we bring in our 9 News medical expert, Dr. Pyle Coley, to talk about it. It's polygenic.
Yeah.
It's a risk that we want to find out about
So
it.
polygenic stands for many genes. It's a genetic risk score. So it takes your DNA, examines it, looks at sort of like which genes you have and what, little changes you have in your genes, and then it makes up a risk for whether or not you're going to get certain types of diseases. So think about it like a credit score, right? Every time you do something with your credit card, whether it's use it or pay it off or whatever, you get points for it. So same thing, they look at your genome and they say, okay, you've got this A over here, you get 1 point. You've got a C over here, you'll get 4 points. They add it up and then they go on to predict the future. So a genetic way, crystal ball to predict the future.
I've never heard of polygenic, that word.
Yeah.
I'm so glad we're talking about it.
Yeah.
And I love the idea that you can spot certain risk factors to prevent certain diseases. So what diseases are covered under this risk factor?
So more and more are coming up. So heart disease is a big one. And there's a colleague and friend of mine at Harvard Medical School who developed essentially a predictive score. His name is Pradeep Natarajan, where they look at your genome and they predict your risk for getting heart disease, for getting diabetes, for getting atrial fibrillation, for getting high blood pressure. And the idea is to predict it early in life so that you can actually do something about it and change it. But it's not just heart disease. We're looking at breast cancer risk scores based on your genetics as well. We're looking at Alzheimer's risk scores. And it's not just about predicting disease, it's about teaching doctors how to use your genes to predict which therapies they should give you. So they can even predict response to treatments and how you metabolize certain drugs so that they know which ones to choose for you. Compared to what we do now, we just say, okay, I'll start you on this and see how you do. Mm-hmm. But it's actually being very smart about using this to predict prescription medications.
Yeah, because everybody responds to treatments and drugs differently. Darn it, our genes, we can't blame, you blame that ancestor and that ancestor and whatever. How do you get the test? Do you have to, and is it covered by insurance? Do you have to ask? Do you have to beg? What do you have to do?
So some of them are still experimental. The one you can get today is the heart disease one. It's not unfortunately covered by insurance. It's $255 out of pocket. It's done through Massachusetts General Hospital, which is part of the Harvard hospital system. But you can ask your doctor for it. And it's a way, again, to predict the future. So if you have somebody who has a high history of heart disease, or somebody who keeps having recurrent heart attacks or strokes, or somebody that you're particularly worried about, this might be something to think about. We could even think about using these kind of risk scores in our kids.
Really?
To predict the future about how they're going to age as adults so that we can start to make interventions.
So is that coming, or this is something that we can do right now with our kids?
So it's coming in the sense that you can't order it today, but it's here in the sense that the research has already been published. And so, for example, Sam, you've got young kids. You can take a kid 5 years and older and predict their risk of developing obesity as a teen, adolescent, and adult. And the idea there is to start to do intensive lifestyle measures to change the trajectory of how they're going to eat, what they're going to do, how they're going to exercise, so that they never develop that obesity. Because one thing that happens with our genes as time goes on, they become harder to modify. So remember, I always say your genes are your hardware. The way that we live our life is the software of how the genes are expressed. So this is not an absolute certainty that you're definitely going to get obesity. It's just you have this predisposition genetically. Now you can change the software by changing your lifestyle, completely changing the trajectory of the disease. Really very fascinating.
So cool.
So it's not just as scary, it's really putting it in your own hands.
Yes.
In a lot of ways, like make a choice.
And
now
it
you know.
helps me as a doctor to make more informed choices. So I would say for anyone who's worried, your 20s, 30s is the time to look, but even in your 40s sometimes, if you're 50s, oh, am I going to go on to get heart disease? Get a polygenic risk score. Talk to your doctor about your risk and talk to them about how you can modify that risk so that you can be empowered to change the outcomes.
Okay, well, I know what you would say, change your lifestyle no matter what. It's good for you, but that's so important. I know a lot of people are going to look into this. You can find more with Dr. Coley at 9news.com/Dr. Coley.